substance abuse. So this is going to be a role patient. We're just going to change around the names and the colleges to keep their identity private, of course. And then we're going to go ahead and interview somebody who worked with this patient, but also somebody who works with substance abuse, and just get a little bit of an insight on how it is to really work with substance abuse patients. Alrighty, so sorry, our patient is going to be Jane. So Jane is 42 years old and she is a Hispanic female. She went to high school and is currently going through some Alamo colleges. She was referred to this clinic where she was previously diagnosed with schizophrenia and type 2 bipolar. It's important to notice that to really put the difference between if it is drug related or if it is schizophrenia, you have to have 5 months worth of hallucinations. Um, and that's 5 months without them taking any types of drugs to really just see where it's starting from and if it's drug related or not. So, a little bit of a background on Jane. Her drug abuse really started when she was with her husband. He was very abusive, even when the kids were younger. And because of the abuse, she would have to go to the hospital and would do checkups and would get prescribed pain pills that she, started to get addicted to. And then she started using cocaine and just really went down this really bad rabbit hole for about 18 years of just constantly using drugs. And she grew up in a very traditional Hispanic household and started losing her faith and kind of blamed her pain on her faith. And then she recently got more interested back into her religion, and she still has the fear of her husband coming back. But this was a couple of years ago, so she's all good now. She's sober, but she is currently taking these three types of drugs that really help with her withdrawal symptoms and anxiety, depression, and all of that stuff. So, like I said previously, she was diagnosed with schizophrenia and type 2 bipolar at the recovery center. Um, and so the person that we're interviewing, he really mainly focuses on humanistic and behavioral types of therapy, right? So he sets goals and he really tries to motivate and push his clients to those goals. So her goals were to stay sober and to really find those trigger points and why she likes to relapse, right? So her relapse was because of the negative thoughts. So when she had negative thoughts, she would want to relapse. So they really just worked on self-care, finding other ways to find that happiness rather than relapsing and just ultimately stay sober, right? So he first started that with understanding the patient. So you have to understand the patient, understand where they're coming from, and understand where the triggers and traumas come from. Um, and after doing those one-on-ones and really just working with her and getting a better understanding of her, he went on and put her with group sessions with other patients who had similarities with her, so that way she can just keep that motivation and, stay sober and just really get more people to talk to, because that was one of her main things, was that she always felt like she was alone and had to be a tough woman. And then when she got into the group therapy, she realized that, there's other things, there's other people that are going through the same similarities, and she's not alone. And so now we're going to go into the interview. Alrighty, so we're going to be interviewing Vincent, and if you can just give a quick summary of your job and where you work.
Yeah, so I'm one of the residential counselors at San Antonio Recovery Center. Basically, in my role, individuals decided to come in for substance use and mental health treatment, and upon deciding to come to treatment, agreed to be in a community residential facility where they live, attend psychoeducation and process groups, as well as individual sessions, every meetings, and different activities that show people the right side of attending events in a sober lifestyle. And so not only do we work with individuals that are day one in sobriety. We also work with individuals who are coming down from substances like alcohol, meth, heroin, cocaine, pretty much any substance you can think of. We work with and really just kind of assist in their process of detoxing and then stepping into the recovery journey.
Alrighty. And so, how would you best describe your style of therapy?
Yeah, so I think I'm kind of like an eclectic counselor, if you will. I meet the client where they're at and really figure out which approaches would be the most efficient. Overall, however, I think that I operate out of the humanistic and the behavioral counseling theories the most. I think that people are greater than their diagnoses. And so, in order to understand a diagnosis for an individual, you also have to understand their complex experiences and the way that they intertangle with one another and express themselves. Um, I also believe that a lot of the drivers to change are internal. And so, if we're constantly looking for external forces for motivation or sustained change, they're just, it's not possible because what if those factors leave? And so, I really build my foundation on emphasizing internal strengths and really expressing the need for building perseverance and determination in their own right. And so, really, those are the two realms that I kind of operate on with the humanistic and the behavioral counseling theories.
All right. And of course, sometimes there can be some difficulties. So, how do you overcome those difficulties with patients?
For sure. So, I think sometimes most difficulties arise from uncomfortability, right? And that's where I think the the biggest piece of advice or saying, if you will, is that the only constant in life is change. And so, really working to change the perspective with clients. And so, rather than expecting them to meet me where I'm at, I try to meet them where they're at. And so, if they're giving me pushback on homework or on just experiences, or if they're really aggressive, I just try to put myself in their shoes and see where they're at. Because by doing that, not only can I expand my understanding, but I can also learn a little bit about what would be helpful, what would be the most important to learn in that kind of situation. Because I think any instance where there is difficulty, it's an opportunity for growth.
All right. And of course, there can be some heavy stuff for you, and it could be difficult for you. So, how do you self care and work on yourself?
Yeah, so I think self-care is extremely important. So I use a variety of different like tools. One to assess how I'm doing in my self-care, but then also to incorporate in my routine. So I use a self-care assessment, which I can send you a copy of, to kind of look at the different areas of self, right? So the psychological, emotional, physical, etc., and see how well I'm doing in those realms. And then after that, I kind of look at the opportunities to spend more time in those areas, whether it's working out more, drinking more water, or spending time with friends, family. Uh, so that kind of helps give me a guide. But some of the kind of practices that I do daily are changing as soon as I get home. Believe it or not, when you wear an outfit at work, your mentality and mindset stays with that outfit. And so change, get into something comfortable to really create that distinction between work life and home life. I also try to create very solid boundaries with work. So once I leave, I'm not doing work at home. I'm not staying up super late. If I do have to work from home, I set specific times that I'm working so it doesn't kind of snowball into me sacrificing my personal time. Um, and then I also have really healthy friendships and family and relationships with family members to where I can call them, chat about the day, and just kind of let off some steam. And then, of course, I just enjoy my alone time as well, right? So having a cup of coffee or a cup of tea at night, and then journaling, really incorporating the skills that I share with my clients. Because if I'm not doing what I'm recommending to them, then I'm not building a strong foundation of trust within them, right? And so I'm kind of being a hypocrite on that level. So really just to try to practice what I preach, do those relaxation skills. All right, and my last question for you is going to be: do you have any advice for anybody who's working with people with substance abuse or anything regarding your foods? Yeah, I think the most important piece is to make sure that you are doing okay. And doesn't mean that you're always going to be perfect or that you're always going to be happy or there's not going to be any stress. But I think it's just you cannot fill other people's cups when your pitcher is empty. And so if you're running on empty, it's going to show in your interactions with others and certainly in your work. And so it's going to be very difficult, especially in a field like this. Mental health is often viewed as like the realm where you're trying to fix other people. And that's not necessarily true, right? You're just trying to help other people learn how to live life a little bit better. And so it's understanding that you can put a lot of effort and time into your clients, but at some point they need to want that as well. And so while you can certainly point them in the right direction, give them the tools to be successful, you can't make them use the tools. And so it's just really staying conscious of your efforts and remembering to take time for yourself. If you don't already have a solid self care routine, find a way to incorporate it within your schedule. So that way you remember just how important you are, especially when you're helping other people.
Alrighty. And this is going to be my reference page, but that is going to conclude my